I'm Robbie Freeman. I'm our Vice President for Clinical Innovation. And today I'm going to be talking about what I call precision nursing. And by that, I mean ways that we can use AI and machine learning to create the next generation of tools. And I'll be highlighting some examples from right here at the Mount Sinai Health System of tools that we're building that will really take our nursing practice to the next level. And I'm hoping that you'll leave today with some examples of ways that we'll be able to use this technology to keep our patients safe and take quality patient care and our nursing practice really to the next level. I'm going to be talking about precision nursing and specifically ways that AI can help support our nursing practice. And I think many of us hear about artificial intelligence. I like to call it augmented intelligence because we still want a human in the loop with even with these AI tools. And I think that there's a lot of opportunity to use technology and AI to support our clinical practice and our nursing practice. And so today we're just going to go over a few examples of cool things that are happening throughout the health system. And I'll talk about a few case studies and publications that we've put out that look at new tools that can help support the work that we do. And so I think in many ways, the nursing profession has been data-driven for ages. And even back to the days of Florence Nightingale, where, Florence used data to show that more soldiers were dying off the battlefields from preventable illness than in battle, in war. And she created beautiful data visualizations, really cool diagrams to really get that point across. And I think, now we're at the point where there's really tremendous opportunity to build new tools to help support, to keep our patients safe and to support our nursing practice. So I'll talk a little bit about AI at Mount Sinai, and then I'll talk about two products that we've built here and rolled out. One is around identifying malnutrition, and some of you may be familiar with the MUST score and how we took MUST and supercharged it with AI. And same thing for falls. We'll give an example of how we took the Morse score for falls and we're able to supercharge that. And I think when you look at a lot of the nursing tools that we use, many of them came from the days of paper. So whether it's the Braden score for skin, the CAM assessment for confusion, you name it, Morse, MUST, many of these tools have been around for ages. And when we had our first iteration of the electronic health record, many of these tools were just transferred right into the EMR. But now that we've been on the EMR for a decade and we've collected a tremendous amount of data, we can create the next generation of these tools that are smarter and more accurate and allow us to keep people safe and work more efficiently. And that's exactly what we're doing at Mount Sinai. And so one of my teams here is our clinical data science team, and we're a small group that really works on creating predictive analytics that end up getting used. And this slide here, I know it's a little busy, but it talks a little bit about the infrastructure that we created. And as soon as you're entering data in Epic, whether it's a flow sheet or vital signs, or the lab is resulting data, or we're doing something from a bedside device like an EKG, that comes across in real time to our data science platform. And we're able to take that data and learn from it and build all sorts of tools. And so we run our predictions, and then we're able to take that predictive score or probabilistic score and either send it back to Epic or do really cool things like send it to a Vocera or send it over secure text. And that's how we can ensure that we have communication, and we like to have two-way communication. So in many cases, we're sending data to Epic and then we're getting feedback back that's telling us, did we get it right or did we not get it right? So just a little bit about the process for, and I'm going to use the terms machine learning and AI a little bit interchangeable, but machine learning really is a field that falls under AI. So your larger umbrella of AI can include things like chatbots and computer vision and machine learning. And so a lot of the examples that I'm going to talk about today are specifically in that machine learning subset of AI, because I think that's one of the areas that's really directly applicable for our nursing practice. And so we always start with some sort of batch data or historical cohort that we build these tools on. We'll use a gold standard for training. So that means we're using a data set that we're really comfortable with the accuracy and the quality of that data. And then we'll try out a bunch of different algorithms. You could think of it like a horse race, and we'll let the best algorithm win. And so the picture here is just a visualization of a tree-based model that we call a random forest. And that one seems to work pretty well with our electronic medical record data. And we go through this process. We start with this batch. We then, once we have our initial tool, we'll run it as a silent pilot. So no one is seeing any results, but we're running everything behind the scenes. So we may be predicting, who on your unit's going to fall, who may end up in the ICU. All of this is happening behind the scenes, and we're validating to understand how well can we predict some sort of event of interest. Then we'll move it to an active pilot, and then we'll scale it from there. And it could take around a year for us to make it through all 4 of these phases of a successful project, because we really want to make sure that whatever we develop is safe and reliable, and we fully understand it before it's ever being used for patient care. So all in all, there's about 30 initiatives running across our 6 Epic hospitals, and we have more than 11 products that are currently in production. Everything from predicting who's malnourished, to getting some insights around patient experience, to understanding who's delirious, how patients are doing on ventilators, some interesting work going on in oncology, and even things like discharge planning, because as we all know, sometimes patients are medically ready to go home, but they end up staying in the hospital because we need things like insurance authorization or waiting for skilled nursing facility. And the discharge planning tool helps us think ahead and plan upstream for a patient's discharge, and looks at who's most likely to go home 48 hours from now, so that when they're medically ready, we're able to really efficiently get them out. And so, I often get asked, what do these tools look like in practice? And so we had sent a film crew around to follow many of our care team members that are working with these tools. And I'm going to play a short clip so you can get a sense of what this looks like on the front lines.
Mount Sinai is bringing data science to the front lines of healthcare. Well, what does that mean to us? Information just tends to sit in repositories, and it's not living, it's not breathing. We have our data scientists looking at the incredible amount of data that we store from our electronic health records and other sources. And we're creating, in a very rapid fashion, tools that can make the world safer for our patients.
We're trying to really push predictions to the frontline providers at the point of care. What we've done is built a number of algorithms that are trying to predict potential problems with patients or predict patients' conditions.
What it does is identify where the patients fall within this algorithm, and if a patient's at risk for fall, the number is actually highlighted in yellow. You can also hover over that score and be able to see the exact risk factors for each particular patient in that moment.
Malnutrition has a major impact on patient care. And so I can look at that tool, and it helps me figure out, of all the patients that I haven't seen so far yet on my unit, who's most likely to benefit from a nutrition visit and who's most likely to have a major nutrition problem.
I'll get an alert on my phone saying this patient has 65% chance of deteriorating in the next 6 hours. And we have 6 hours ahead of time to stabilize that patient. With this technology, you are improving survival. It is absolutely a game changer.
What we're able to do with our machine learning models is pick up these small signals that are happening that a human would never be able to pick up.
We're creating not just technology, but technology that is accessible and usable for the healthcare delivery professionals. That's the vision as we go into the future.
So you just saw a quick snapshot of what some of these tools look like in practice with our care team. And I'm going to zoom in on a couple of use cases here. One is our machine learning model that identifies malnourished patients. And so here's just, we did publish our findings in the Journal of the American College of Nutrition. And if you're interested in learning more, feel free to go to the link here at the bottom, or the DOI, and you could read more about this work. So in this case, we had worked with our registered dietitians and started talking about what could a tool look like that helps us prioritize patients who are most likely to be malnourished. And so the previous workflow was the RDs would go in, they would see their patients, they would do a physical exam, and then they would document whether or not the patients are malnourished. And that data was really valuable for us for building our model. So we need to know not just the positive cases, but the negative cases. So like the patients who are not malnourished as well. And we sat down and we ended up proposing a new workflow where we would have this malnutrition predictive engine, and we would be able to populate a patient list for our team of registered dietitians. And that way, when they come in the morning for work, they would have a ranked list and know what order to go and screen their patients. That way, if on a given shift you're able to see 15 patients, you can spend your time best on the 15 that the algorithm helps identify. So I talked earlier about the batch model. So we always start with a batch, and our performance here, we looked at some of the kind of tools that you may be familiar with, like sensitivity and specificity. And then we often plot our results on what's called the receiver operator curve. So when you work with predictive models, you'll often see these types of curves here. And what we measure is that area that's under the curve. And that tells us how well can a tool predict some sort of event of interest. So if this number was all the way on the top left here, it would get it right every time. And if it was a diagonal line, it would be a coin flip. So a 0.5 would be 50% heads, 50% tails. And so generally a good rule of thumb is that anything above 0.8 is a pretty good model, and 0.9 is pretty stellar. So we were happy with this initial results that we saw here with the sensitivity and specificity and this number for the area under the curve. So we ended up testing this in the background silently and then moving it to an active pilot. And this is today what our team sees in Epic. So if you're a registered dietitian, you would come in and you would see your malnutrition predictive score. It's color coded. It also tells you kind of what's happening under the hood. So what are the reasons why, or the features that are making this patient at high risk. And so this example, which is a snapshot from Epic, this patient had a high BMI. It had to do with their albumin, their age, their height, how long they've been in the hospital, and some of their lab data. So, the machine's much better than us as humans as picking up on all these little small changes that can happen with our patients. And it's able to do a good job at pattern recognition. And so in this case, the machine and the algorithm had flagged this patient as high risk. And then our RD team will go in, assess the patient. They'll come back and they'll document on their Epic flow sheet. They'll say, yes, this patient was malnourished, or no, not at this time. And we're able to take those yeses and nos and understand how we're doing. So we ended up starting this project at Mount Sinai Hospital, and we quickly expanded to the other Epic hospitals across the health system. And we've seen consistent performance with these numbers, the receiver operator curve, similar to the performance that I had shared on a previous slide. And then what we do is we can take all those yeses and nos and we can retrain our model so it can get more accurate over time and continuously learn from the data. And that's one of the powers of machine learning and AI, is that we can get smarter and smarter and more accurate over time. And we've seen that with our malnutrition AI tool. And this here on the left-hand side is what's called a precision recall curve. And this is the area under that curve. And then on the right is the same receiver operator curve that I showed earlier. So we had a boost in the performance when we went from the first version to when we retrained the model, where it learned from that data and we moved to that second version. We also like to create different tools or scorecards to understand how we're doing. And this is just some examples of the type of tools that we use, such as a heat map. So this is a heat map to look at our different service lines to understand where there may be some opportunity. We also have in real time generate these receiver operator curves. And on the top left, you can see one of the metrics that we look at, which is who do we predict needs some attention, who were we able to see, and then out of those cases, how many of them were positive. So if you're interested in this topic, I encourage you to read more. Feel free to check out the article that I had shared. And so I want to move on and give one more quick example of another tool that was developed here at Mount Sinai. So one of the first projects I worked on when I started working in predictive analytics was looking at the performance of the Morse tool to identify patients who are likely to fall. And here's a publication that we published last year in the Joint Commission Journal on Quality and Safety on the tool we created to predict which patients in the hospital are most likely to fall. So I think, as we all know, when you walk onto many of our inpatient areas, you'll see yellow socks and yellow stickers and yellow bracelets. And, oftentimes there could be a high proportion of patients that are likely or that score high on Morse that were likely to fall. And what we saw when we looked back a few years is that Morse does an okay job, but not a great job in predicting which hospitalized patients are likely to fall. And what you can see here on the right is the proportion of patients that end up in a high risk, medium risk, and low risk for Morse. So Morse only, if we look at that area under the receiver operator curve, the area is about a 0.68. So that'd be like a C. So not a great model, and has some predictive power because it's greater than this diagonal line, which would be just random 50-50 chance. So there's some predictive power there, but it seems like we could do better. And so we ended up bringing in additional information. So laboratory values, information from our nursing assessments. And so it turns out that a lot of that data that we enter during the nursing assessment is really valuable. And we saw things like, if we document that the patient doesn't sleep well at night, they were more likely to fall. Some of the information we put in that Braden assessment also was predictive on which patients are likely to fall. Some of the information we document for the mobility status of a patient. As you can imagine, patients who were bedbound did not fall very much. And so a lot of great data in our flow sheets, and AI and machine learning allows us to really unlock that data and make the most of it. And so we ended up building this new model called the enhanced fall risk model, and we saw that we were able to get to a predictive power of just over 0.8. So pretty big jump from Morse to this enhanced model. So similar to malnutrition, we built this into Epic. On the left-hand side, you can see what it looks like. You can hover over an Epic and get some more, drill down for some more information on what's going on. And then on the right-hand side, you can see kind of how we improved from the initial version of Morse to the enhanced version. So the enhanced version takes our Morse score, but then adds in that additional information to boost the performance. So you can see many patients shifted down from the highest risk bucket. So in the blue here is the old Morse, and in the gray is the new tool. And so we're able to focus our efforts and our interventions on that smaller cohort of patient who are truly at the highest risk. So this cohort falls at a much higher percentage rate. And then we can shift more patients down into that medium and low risk. And so we can use our limited time more effectively. And we see this across many of the projects that we work on, is that these tools are not like a magic bullet, but do allow us to more efficiently spend our time and risk stratify and pick up on some of those trends that really, computers are really well suited to pick up on. So of course, it's not enough to just kind of predict who's going to fall. We want to combine that with effective interventions. So things like remote patient monitoring, things like falls not. So if we don't prevent the fall, we can prevent the injury. We need to implement effective interventions to get the most out of these tools. And what we saw in our initial pilot areas is that we were able to see a sustained reduction over 14 quarters in the falls rate when we were using the tools along with effective interventions. So that was what I wanted to share with you today, a very quick and high-level overview of ways that AI and machine learning can support our nursing practice and really get us to what I call precision nursing, which is using technology, using tools to support nursing practice and to take patient quality, patient safety, and the patient experience really to the next level. And I think that we're really just scratching the surface. There's a lot more that we could be doing. These were just two initial projects, publications, tools that we've created here at Sinai, but I'd love to hear kind of your big idea on how we can innovate and create the next generation of tools that help keep our patients safe. Thank you, everyone.